So in periodontics, there have been a number of innovations in the past 5 to 10 years. For example, we don't reflect flaps as often when we take out anterior teeth. More often, we're not releasing papillae when we do root coverage procedures. So there's kind of a trend toward minimally invasive therapy, and we're seeing the benefits of this in a number of different areas. But up until the LANAP protocol, we really haven't had a good alternative to flap and osseous surgery. And those of us who have treated patients with flap and osseous know that while it's effective, patients aren't necessarily always positive about the results that they get from it. Even when we as periodontists are happy with how an osseous case turned out, sometimes patients come back and they say, well, now I have these black triangles and now I have sensitivity, and it was an uncomfortable procedure. So LANAP is really a different experience for patients, where they come back and they had minimal discomfort and they can appreciate that things feel different, and they haven't ever realized what it's like to not have inflammation in the gums. And I think that's something that's a totally different experience for patients. When I first heard about the LANAP protocol, I was skeptical about treating moderate to severe periodontitis using a non-surgical approach. Being Air Force trained, the literature was very strongly emphasized, and when I think back to studies showing that non-surgical therapy wouldn't be effective, I didn't understand how the LANAP protocol could be different. But what I now understand, having been through the training, is that LANAP really is a minimally invasive surgical therapy, and I think of it in the same way that I think about doing a flapless extraction or a tunneling technique for root coverage. We're still doing surgery, but we're doing it in such a way that's less invasive to the patient and preserving the blood supply. Before the LANAP protocol, I was more likely to extract teeth during the initial phase of treatment, but now with LANAP, I tell patients, I don't know for sure how these teeth will respond, but I think it's worth giving a shot at trying to save them, adjusting the occlusion, treating them with the laser, and following up in 9 to 12 months with 2-month maintenance intervals. It's amazing how many teeth we used to be extracting that we can now save. A lot of our patients have known for a long time that they need to do something about their periodontal disease, but they've been avoiding it because they're apprehensive about going through the conventional surgery. So when they find out that LANAP is an option for them, they're typically very excited about it, and that means that they're going to want it to work. And when patients want something to work, that means they're more compliant. They come in for their cleanings, they do exactly what we ask them in terms of home care, and when we have that buy-in and the whole team is kind of working together, I think we see better results. I'm looking forward to seeing the long-term results, as the short-term results have been very promising in my patients. I'm looking forward to doing more cases, and I'm looking forward to more research in the future that sheds light on some of the mechanisms that are taking place in some of these regeneration cases that we're seeing anecdotally.